On March 11, 2020, the World Health Organization declared the novel coronavirus to be a pandemic. But what exactly are the conditions required for a disease to be considered a pandemic? Let's find out. Epidemiology is the study of the distribution and causes of health-related states and events in specified populations. This includes public health problems such as infectious diseases, but also events such as natural disasters. For example, the devastation of Hurricane Katrina in 2005. Epidemiologists are scientists and doctors who study the transmission of diseases and how they affect populations. You can think of them like disease detectives. They try to search for the cause of a disease, determine who is at risk, and determine how to control the spread. An epidemiologist will use terms like endemic, outbreak, epidemic, and pandemic to describe the number of cases of a disease in a certain region compared to what is usually expected. These terms are often used interchangeably, but they mean completely different things to an epidemiologist. The amount of disease that is usually present in a community is referred to as the endemic level of the disease. This can be thought of as what's normal for the occurrence of a disease in a particular region. If a disease is endemic, it is usually fairly stable and predictable. For example, chickenpox, the name given to the disease caused by the varicella zoster virus, is endemic in most countries throughout the world. The number of reported cases of chickenpox in Canada from 1986 to 2017 is shown below. From 1986 to 2003, the number of reported cases ranged from a minimum of 12,773 to a maximum of 72,343. with an average of approximately 34,000 cases per year. Keep in mind that these are reported cases, so the actual number may be much higher. What I found very interesting was that the number of reported cases significantly declined in 2004 and has remained steady at that level since. The reason for this is vaccination. From 2000 to 2007, Canada began implementing immunization programs across its 10 provinces and 3 territories. The province of Ontario, which has approximately 40% of the country's population, was vaccinated in 2004. This likely explains the significant drop in the number of reported cases from 2004 onward. Since the vaccination program was completed in 2007, the average number of reported cases in Canada from 2007 to 2017 was approximately 749 cases per year. This would likely now be considered as the endemic level of the chickenpox in Canada. Sometimes the number of cases of a disease in a region might increase. An outbreak occurs when there is a sudden rise in the number of cases of a disease, which is greater than what would usually be expected. Sometimes even a single case can be considered as an outbreak. This can be true if the disease is unknown, is new to a community, or has been absent from a community for a long time. In 1998, Canada declared the measles to be eradicated. Measles is a highly infectious disease caused by the measles virus. It is the most contagious transmissible virus known. It is spread through coughing and sneezing and can live for up to 2 hours in the air. Measles can be prevented with vaccination. From 1996 to 1997, Canada introduced a 2-dose measles vaccine to its routine immunization schedule. As a result, the last case of measles due to endemic transmission occurred in 1997. Even when a disease has been eradicated, outbreaks can still occur. For example, in 2011, the Canadian province of Quebec experienced a measles outbreak. In that year, the province reported over 700 cases of the disease, which was the largest outbreak of the disease in Canada since it was declared eradicated. Outbreaks like these can be caused when the disease is imported from abroad. Secondary spread of the disease can then be spread among members of the population who are inadequately immunized. In some cases, outbreaks spread from the point where they originated. An epidemic is an outbreak that has spread over a larger geographical area, but still limited to one specific region. For example, in 2014, West Africa experienced an Ebola epidemic. The first cases of the disease were recorded in Guinea in December of 2013. Soon after, the disease spread to the neighboring countries of Liberia and Sierra Leone, with some minor outbreaks occurring elsewhere. Over the course of approximately 2 years, there were 28,616 cases, including 11,310 deaths. That is a mortality rate of nearly 40%. This was the largest Ebola epidemic in history. The public health emergency relating to the epidemic was lifted in June of 2016. A pandemic is an epidemic that spreads globally. This occurs when a disease spreads across countries and continents. On December 31st, 2019, the World Health Organization was informed of a cluster of cases of pneumonia in the city of Wuhan, China. Soon after, the cases were attributed to a new type of coronavirus, hence novel coronavirus, which was later named Severe Acute Respiratory Syndrome Coronavirus 2, or SARS-CoV-2. Over the next 2 months, cases of COVID-19 were reported in 126 countries. Being deeply concerned by the alarming levels of the spread and severity of the disease, the World Health Organization made the assessment to characterize COVID-19 as a pandemic on March 11, 2020. Throughout history, the human race has faced several pandemics. Here are some of the more notable ones that occurred during the last 100 years. In 1918, the world faced a deadly influenza pandemic, which is commonly referred to as the Spanish flu. Due to its name, many would believe that this virus originated in Spain, but this was not the case. This pandemic coincided with the end of World War I. In order to maintain morale, wartime censors minimized early reporting of the illness. Spain was one of the few European countries to remain neutral during World War I. As a result, the Spanish media were free to report every detail of the pandemic. This made it natural to assume that the virus originated in Spain, hence the Spanish flu. This was one of the deadliest pandemics in history. It infected about 1/3 of the world's population at the time and resulted in an estimated 17 to 50 million deaths. Fast forward to 1957 and the world was faced with another influenza pandemic. This one originated in China and is commonly referred to as the Asian flu. The virus caused an estimated 1 to 2 million deaths worldwide. About 10 years later, in 1968, the world was faced with yet another influenza pandemic. The first outbreak of the virus was recorded in Hong Kong, which is probably why this pandemic is commonly referred to as the Hong Kong flu. The estimated worldwide death toll was approximately 1 million. About 40 years later, in 2009, the world was challenged with another influenza pandemic, which is commonly referred to as the swine flu. This was caused by a new strain of the H1N1 influenza virus. The number of worldwide lab-confirmed deaths was reported to be 18,449, though the actual number is thought to be much higher. Currently, we are all living through COVID-19. As of the time that this video was being researched, COVID-19 has infected almost 3.5 million people. Of these, approximately 246,000 people have succumbed to the disease. In summary, the terms endemic, outbreak, epidemic, and pandemic are terms used by an epidemiologist to describe the number of cases of a disease in a certain region compared to what is usually expected. It can be challenging to apply these definitions to diseases in a real-world situation that is constantly evolving. Consider the evolution of COVID-19. On December 31st, 2019, a cluster of cases of pneumonia due to an unknown source was reported in the city of Wuhan. At this time, this disease of unknown origin would have been classified as an outbreak. By January 20th, the disease spread throughout Asia to Thailand, Japan, and South Korea. If the disease would have been contained in Asia, it may have only been classified as an epidemic. However, by March 11th, it had spread globally to 6 continents. The spread and severity of the disease allowed it to be characterized as a pandemic. What will be the future levels of COVID-19? Will we eradicate it, much like how we did with the first SARS outbreak of 2003? Or will this be a disease that we have to learn to live with, much like how the seasonal flu and common cold are endemic in many parts of the world? Only time will tell. Have a question? Leave it in the comments below. If you like this video, be sure to give it a like and subscribe to this channel for more.